Hi, everyone, and thanks for joining us today. I'm Jill Vitale-Awesome, President and CEO at Christian Living Communities and Capella Living Solutions. And it has been about a year since we did a facts versus myths Facebook Live show about COVID-19, and a lot has changed. And then some things haven't changed, right? It's kind of hard to believe that a year later we are still kind of in this situation. A year ago, vaccines were just starting to roll out, and many of our CLC Capella communities were in the throes of virus outbreaks, which really challenged us last year to be creative in celebrating the holidays. And as we know, vaccines have been available now for almost a year. Boosters are not only highly recommended, but are expected to become necessary to be considered fully vaccinated. And we're seeing the virus mutate and variants emerging, the Delta variant and now the highly contagious. But from what we're hearing, we'll be talking more about this, perhaps less impactful Omicron variant. And with information, recommendations, things always changing, we wanted to share with our CLC Capella residents, our families, our team members, the facts as we currently know them and separate them out the myths that are circulating. We'll also share some of the unique ways we're thriving during this second year of this pandemic and how we're balancing health and happiness, especially during this holiday season. So with me today, I have Dr. Eric Gomer, who is our CLC Medical Director, and Pat McBride, who is our CLC Capella Vice President of Clinical and Compliance. Welcome, Pat. Welcome, Dr. Gomer. Really glad to have you with us.
Hello.
Hi, nice to be here.
All right, thank you. So for all of you out there watching, the chat box is available to ask questions. So all you need to do is go into the comment section and put your question in there, and we will share questions at the end of our discussion today. But let's first start out with the facts as we know them. And Pat, I'm going to ask you to share the latest data.
Sure, thanks, Jill. So many of you are aware of this really grim statistic that the United States has surpassed 800,000 deaths due to COVID. Over 1,000 people are dying today from COVID every single day. And some hospitals are the busiest they've ever been since COVID started, especially in the Northeast and the Great Lakes area. And some hospitals have national disaster teams coming to help support them. So we still have trouble. We're still in the middle of COVID. And Robin, if you could bring up the map. We do have some cases. We have high or substantial COVID areas in the states that we serve, and that is Colorado and Indiana, Ohio, Utah, Texas, and Oklahoma. And red is higher substantial. You can see this is CDC guidance or data. We have Utah and Texas have the least number of COVID cases currently, and Ohio and Indiana have the highest rates. And you know, this is very fluid and changes all the time. So we do unfortunately have COVID in our communities and in our country as a whole. Thank you, Robin. The impact of COVID amongst our older adults has really been devastating. CDC just announced a really sad statistic that says 1 in every 100 people ages 65 and older have died from COVID since the beginning of this pandemic. 1 in 100, 65 and older. And just for comparison, anyone younger than 65, the ratio is 1 to 1,400 people that have died from COVID. So it's been very devastating to people over 65, those that we serve. Currently, we have COVID activity in some of our communities, specifically Ohio, Indiana, Utah, and Colorado. Some are actually in outbreak status. So we are not out of the woods. We do have activity in our communities. And again, that is very fluid also, and it comes and goes. Now, the good news is that because we are vaccinated and because we have had vaccine clinics and booster clinics, and we're continuing to have those. So anyone that wants to be vaccinated in our communities can be vaccinated. Because of that, the impact of the current COVID activity has been lessened. So unfortunately, we're seeing people getting sick, and unfortunately, we're having some people pass away with COVID. But the impact is less than it was a year ago. Our numbers are less. We have fewer severe illnesses, fewer hospitalizations, and thank God, fewer deaths from COVID.
Thank you, Pat. Appreciate that very much. Dr. Gomer, there's a lot of confusing information out there about the virus and the variants and what does it mean to be fully vaccinated. Could you tell us the latest of what is known about the COVID-19 virus and the variants?
Sure. This virus, I like to remind people, is a cold virus. It's in the family that we see our other common cold viruses. And if you think about the cold, you're never completely done with it. There's always a strain that may get you every few years or so. You get a little bit sick, but it is something that we, as we've grown up as infants and children and young adults, we've seen it hundreds of times. This coronavirus that we're dealing with, COVID-19, the Delta variant, the Omicron variant, it is similar to that, except that no one has ever seen this virus. No human had seen this particular type or strain of coronavirus back in 2019, 2020 when it came out. So what this means is this virus will continue to mutate, and that we'll have new strains that evade our immune system, our vaccines a little bit. But what we're showing is that when you have vaccination on board, probably previous infection, and most importantly, booster vaccine, you have enough memory or knowledge of these strains that it gives you some good protection. You may still get sick, but you don't have a serious of infection. You don't have the high risk of going to a hospital or, God forbid, dying. So I want to try and tell people that the variants can be concerning when you hear about a new strain, and we may even see a new strain after Omicron. What we're battling, though, is getting our immune system caught up to pay attention to this virus. And the booster shots right now seem to be doing that. One last thing about these variants is we're not sure what the ultimate variant will be, or if it will just kind of be similar to what Delta and Omicron are, in that this virus, as it evolves, it doesn't want to become more deadly. It wants to just reproduce as much as it can. And so right now we have an Omicron variant that may not be as deadly, but it is excellent at reproducing. And this may be what we see in the future with this virus, is that it can spread very easily, just like a cold, but we have a little bit of protection against it from vaccines, from previous infection, and especially boosters. So I try not to get people panicked about this. It is important that we pay attention to it and protect ourselves, but it doesn't mean we're going to see it evolve into a super strain that's incredibly deadly. That's typically not what you would see with a virus.
Thank you, Dr. Gomer. And again, highlights the importance of being vaccinated. And if you're eligible for your booster, getting your booster, right?
Absolutely, yeah.
And what are we hearing about the boosters right now?
Well, along that line, they're studying this Omicron variant a lot now. There's new research every day, new data every day. And yes, they did show that it's not the normal vaccination process with the 2 doses or having a previous infection where you have some immunity. It isn't that protective for this strain. You still get sick from it, and you can still get hospitalized and get very, very ill. However, when you add a booster shot, you add that third shot, if it's a Pfizer series or Moderna series, that seems to give you a good amount of protection, and it does reduce your risk of hospitalization and death. So again, it's just giving your immune system a little sniff, a little touch of what this virus is without giving you the full-blown COVID infection. and it gets it caught up. I like to tell people it's catching up your immune system to these variants or strains.
Thank you. Pat, I want to ask you a question. It's so interesting. Some states have statewide mask requirements, in different counties have different requirements. And some of the things we're hearing in different areas where our communities are located is, well, do masks really work? So there's questions about, their effectiveness. And I would be really interested to hear what the experience has been in our communities, and what does the data show about masks?
So, I mean, we're all tired of wearing masks. I get it. And we're getting very different mixed messages depending on where we live in the country. But frankly, the simple answer is yes, masks work. And we see it in our community. We see that when people are wearing masks, and specifically correctly, so over the nose and the mouth, we can see a reduction in the virus spread in our communities. And we specifically have some trouble with that compliance in our memory care neighborhoods with people living with memory care, but our teams are so creative and so good at trying to maintain masks that we're seeing some really good compliance there also. And CDC did a really big study, and they looked at masks and how they can reduce air droplet transmission, which is how COVID is transmitted. And they saw that it reduced transmission by 50%, 50. So that's pretty significant. And, it's really important, even if we are, really good about being vaccinated and booster shotted, that we wear the mask, because, people sometimes can carry asymptomatic COVID. So we don't know we have it, but we're carrying it. And so the mask keeps us from transmitting it to other highly vulnerable population that we serve.
Thank you, Pat. So we encourage everyone, even if you live in an area where there isn't a mask requirement, to wear them. And when I try to remind myself of that, when I go to the grocery store, like, do I want to put on this mask? Healthcare workers, including our team members, have been going to work every day for their whole shifts for almost 2 years wearing masks. And if they can do it, I can do it. That's how I look at it, right?
That's really true.
And if it can help our situation, then it's so worth it.
Can I add something?
Yes, please.
To Pat's point, another interesting set of data is how the flu spread, or really didn't spread, last winter. And part of that is because of the social separation and lockdowns, but also the mask use. So that was very good evidence that mask use can reduce spread of other illnesses that are considered airborne.
That is a great point, and this is a great opportunity to remind everyone, if you have not yet, to get your flu shot too, right? We don't want to have more flu cases spreading, especially when our hospitals are so full already.
Right.
So if you haven't done it, do it. And Pat, you were sharing that there was some information just yesterday that was really, really concerning about how the virus variants are duplicating and mutating. Could you talk a little bit about that?
Sure. So this is hot off the press. So just yesterday, we attended a meeting through the American Healthcare Association, very respected group, and Dr. Gifford presented about Omicron. And, the first case started in South Africa not too long ago. That was November 9th. And now the variant is in 60 countries. It's in 30, I think yesterday was 33 states. It could be more now. 2/3 of cases that we're seeing are acquired in the United States, not brought in from foreign traveling. And it's being seen in wastewater tests, even in our backyard in Boulder, Colorado. So it's here. And so I wanted to share some of the data that Dr. Gifford shared. So Omicron spreads 3.2 times faster, more quickly than Delta, 3.2 times. Cases double every 2 to 3 days, they saw in South Africa, as well as other studies in the United Kingdom. So that means that if we have 100 cases, of Omicron variant right now. In 2 to 3 days, we will have 200. So for perspective, the Delta variant doubled in about 11 days, and the first COVID doubled in about 3 weeks. So this is much more contagious. It's 4 to 5 times more infectious than Delta based on a few studies. Now this is preliminary studies because it just started in November. And Omicron is about the same or less virulent than Delta by these studies. So just like what Dr. Gomer said, the symptoms seem to be less than from the Delta variant. And 3 studies found that the vaccines were 74% effective if you have a booster. So I want to say that again, 74% effective if you have a booster shot. And without a booster shot, only 34% effective. So if you just have the 2 doses, that's pretty significant. And the booster increased antibodies by 25-fold. So it had a really good response. Omicron causes more breakthrough infections than Delta, which we've been talking about. And boosters in these studies showed that they were effective 10 days after you got the booster. And Omicron will become, some experts are saying it'll become the dominant strain in January. So right around the corner. So they also shared a really interesting study. This study included 843,000 elderly, and they define elderly as greater than 50 years old. And they compared the impact of the booster shot. And what they found in this really large study was that the boosters created a 90% reduction in mortality rates in those older than 65 years old. 90% reduction in mortality rates if you're boosted. So some pretty good statistic to support us making sure we get our booster shots.
Definitely. Thank you so much, Pat. And when you talk about vaccinations and boosters, Dr. Gomer, we're hearing so much, and some people are experiencing this firsthand. Definitely our healthcare workers in the hospital settings, that hospitals are full, and that we really need more people to get vaccinated and get their boosters to reduce that hospitalization rate. Curious to hear what you're seeing, what you're hearing. What are you experiencing?
Well, that's exactly right. The hospitals are full here in Colorado, and as you hear in the upper Midwest and Northeast as well. And even though we're starting to see a little trend downward in the cases, as you know, the hospitalizations and then deaths lag. So we're not quite seeing that drop yet in the hospitals. And it's important to bring that up because people may say, oh, well, this strain isn't as deadly, or the deaths seem to be not as high as last surge. But what we need to remember is when hospitals are full, that affects all of healthcare. It affects anyone coming in with a stroke or heart attack or traumatic injury, people that need special surgeries, and of course the physical and mental toll on the healthcare workers. So trying to keep that down is very important. When we talk about getting vaccinations and boosters, we're of course wanting to protect the individual who's getting it, but it also helps with the community, helps reduce transmission and infections that end up in the hospital. One thing I do want to say is when we are talking about getting vaccinated to help reduce hospitalizations, just to remind people, it unfortunately does not tremendously reduce symptoms. You may still get infection. And as Pat talked about, breakthrough infections, they're more common with Omicron. And we see them a lot with Delta too. Most of them are mild, but I think people need to get their heads wrapped around that even if they're vaccinated and boosted, they may still get cold symptoms or, a very mild flu or something like that. But the risk of going to the hospital, having serious complications is very low with those vaccines.
Thank you, Dr. Gomer. Pat, will you talk a little bit about what's happening in our communities?
Sure. So I think it's really important to have perspective and look back as to where we were last year. to really give perspective of how we're doing now. So remember last year we had, our communities were basically shut down. People were visiting in warming huts outside or through windows or through cherry pickers through the windows. The holidays were typically spent alone in our communities, staff and residents. We were probably about this time, we were trying to procure vaccines. Remember how hard it was to find vaccines? But we found them. And then we had the issue of not having enough personal protective equipment. And so we were trying to make sure we could find that. It was really quite grim. It was a quite grim holiday for many people. Now, today, we are not in that situation. Even though, as I stated before, we have COVID in some of our communities, some of them are on outbreak status. We have visitation. It's limited very rarely. We know a lot more about COVID and how it transmits. We're not wiping down every piece of package that comes through the door like we used to. We have plenty of personal care equipment. We have N95 masks. Our dining rooms are open. People are able to dine together. We have life in our communities. We have music again. We have entertainers. We have people visiting in the hallways. So we're in a much different place, and we're so grateful for that.
Absolutely. Absolutely. There are some bright spots in all this, right?
And the beauty parlors are open.
Yeah. Well, that is critical. To have the salons open. That's critical. I want to remind people who are out there watching, if you are watching this as a recording after it goes live, if you put questions in the comment box, we'll be monitoring that, and we'll have Pat or Dr. Gomer get the information and respond to any questions that you have that may come in after the show. If you're watching this 2 days after our live broadcast here today, or 2 weeks after, or whenever it is. But there are 2 additional questions I wanted to pose to both of you. So Pat, we're hearing a lot about the monoclonal antibody therapy, and many of the states where we have communities, they require that if a resident tests positive for COVID, that they be offered this therapy. So could you talk a little bit about what is it, and how is it being offered in our communities? And so if a team member or family member tests positive for COVID, and if they are offered that through their healthcare provider, should they get that therapy also? What do you know?
Sure. So monoclonal antibody therapy is basically a form of immunotherapy in which the monoclonal antibody is injected into someone suffering from an illness to help stimulate the body to fight the illness. So it's been used for people with certain types of cancers. It's been used for treatment for just recently for MS, and now for COVID-19. And so there's some rules around when you can get monoclonal antibodies. So first thing is you have to be able to show that you've tested positive for COVID. And then you have to be within 10 days of your first symptom, preferably 5 days. That seems to be when it's the most effective. If you get this within 5 days of your first symptom, but you can get it within 10 days. It is given, it used to be given just by IV, but now it's also being given by an injection. So it's a little bit easier to give for people in their homes currently. And you do not, in most states, have to have a physician order to get this. So if someone in our communities tests positive for COVID, we will consult their physician and we'll discuss monoclonal antibodies to see if they are appropriate for them. And typically it's people that are of high risk, which includes an older age or people with chronic kidney disease or lung disease or heart disease. So many of our residents are able to get this monoclonal antibody, but we discuss with the physician and then we make it happen. So we've had this in many of our communities. Sometimes the resident will be sent to an infusion center or a urgent care doctor or a hospital to be infused, but hospitals are super busy right now, so that's not how it's typically happening. Typically now we consult with certain doctors and companies that will come out with typically a home health nurse, and they will do the infusion or give the shot if someone qualifies. And if our staff members or family members come down with COVID and it's within 5 to 10 days of symptoms, they can then qualify also typically for monoclonal antibodies. And there are websites in each state as to where to find those clinics or who will do them. And so they're all over. There's so much more available now than they were months ago. I just want to point out that this is not a replacement for being vaccinated and boosted. This is if you come down with the symptoms, and they have to be pretty severe. These aren't just the mild symptoms, right? This is what will happen. And so typically those that are not vaccinated are the ones that will probably be getting the monoclonal antibodies, because they will be the ones that will have the most severe symptoms and qualify. And then if you then decide that, I don't want to do that again and I better get my vaccine, you can get that 90 days after you get the monoclonal antibody therapy.
Great. That's such great information. Thank you. That raised another just a question. So if somebody, so we're going into Christmas, right? People together, people traveling and all these things. So if someone gets back from their trip to see their family and they have symptoms, it might just be a cold. Do you recommend people get tested?
Well, yeah, because information is power and it helps us protect people. So knowing if you have COVID will increase your desire to wear a mask and to isolate so that you're not infecting people by going to the grocery store or having people over to your house. So yes, I think, of course, you should get tested if you have any symptoms. Knowledge is power.
Okay. And so you can pick up an at-home test now, right? Mm-hmm. You can do those, or you can also go to, there's so many different places now, pharmacies, your healthcare provider, clinics all over the place where you can go and get tested.
Right, exactly.
So, yeah, okay, great. Thank you, Pat. And Dr. Gomer, last question for you. So we've been hearing that Pfizer is testing a new antiviral COVID-19 pill, and they're saying, I think I saw that it's 90% effective at preventing hospitalizations and deaths in high-risk patients. What can you tell us about that and when that pill might be available?
Yeah, it's an exciting development, kind of like when we were learning about monoclonal antibody treatment and having that as a new treatment for COVID. This is a little bit more cutting edge. It's a pill, so very easy to use. You take it twice a day for about 5 days. It reminds me a lot of Tamiflu. If anyone's ever taken that when they have the flu, you start it as soon as you know you're sick. You take it twice a day for 5 days. And like Tamiflu, this pill seems to reduce the serious risks or complications involved with a COVID infection, most importantly, hospitalization and serious illness or death. Again, it does not really reduce symptoms that much. That was a study that didn't pan out as well for this pill. People still had symptoms, but the most important factor of reducing the hospitalizations and serious illness, that did pan out, and that was, like you said, about 90% effective in reducing that. This pill, I think it's called Paxlovid. It's through Pfizer. They have submitted an approval through the FDA, so I think it's just in committee right now. I believe we should hear something within the next few weeks. There is also another pill by Merck. I don't know the name of that pill that's similar. It's taken to reduce complications. I don't think it's as effective as the Pfizer, but I don't know the numbers on it. So these are two new developments that could really change how we approach COVID. Again, it doesn't mean don't get vaccinated or whatever. You don't want to get sick and play the Russian roulette of, am I going to be okay on this pill? But if you have someone who's vaccinated, boosted, they still get sick, and you're worried that they are at risk, then this could be a big game changer.
Great. Well, I want to thank you both so much for taking the time today. This was such helpful information, and I hope it helps everybody out there watching this. And again, if you are watching this after the live broadcast ends, you can still put questions or comments in the comment box, and we will get back to you to answer any questions. Pat, Dr. Gomer, CLC and Capella are so fortunate to have you with your clinical expertise and guidance through this really challenging time. And again, thank you for making the time to be here with us today.
Of course.
Thank you. Our pleasure.
Thank you. Thank you, everyone. Stay safe and stay healthy during this holiday season.